The following video will demonstrate how a subcapital metatarsal osteotomy is performed on the digitus quintus varus using the shark screw allograft. The surgery is performed on the right foot of a 37-year-old patient. The X-ray shows the deformity of the metatarsophalangeal joint. A lateral incision is performed and the joint capsule is released underneath. Afterwards, the joint capsule is opened and the metatarsal head is exposed. After loosening the capsule, the exotosis is removed using an oscillating saw or drill bit. The center of the metatarsal head is determined and fixed using a K-wire to mark the osteotomy axis. A saw jig or clip is used to guide the saw blade. It is essential that the dorsal osteotomy is short and steep, while the plantar osteotomy is long and flat. The metatarsal head is repositioned, pressed against the shaft, and temporarily fixed from lateral with a K-wire. A second 1.2 millimeter K-wire is inserted from proximal dorsal to distal plantar, which corresponds to the desired position of the shark screw. It is important that after drilling and tapping, enough cortical bone will remain for solid fixation that is then checked on the X-ray. Depending on the size of the bone, the appropriate diameter of shark screw is selected. In this case, the blue-labeled 3.5 millimeter shark screw was chosen. The blue-labeled drill is used to drill the core hole over the K-wire up to the subchondral bone of the metatarsal head. The depth of the drill hole can be determined using the laser marking. Next, the drill and the K-wire are removed and the nut thread is cut with the blue marked tap. Again, the depth of the drill hole can be confirmed using the laser marking. It is important to rinse the canal with saline solution to remove any fine bone shavings that are produced during tapping. The shark screw is screwed in with a screwdriver without much resistance. The nut thread and screw thread are interlocked tightly and are stable in each direction. After checking the position of the shark screw on the X-ray, any excess material is sawed off to the bone level, and the surface is smoothened with the bone mill. The shark screw now acts as a bone bridge and leads substance for the patient's own cells. It is recommended that the patients wear a 4-foot relief shoe for 4 weeks. Shark screw allografts are made of cortical donor bone. It can easily be seen on the X-ray post-operatively. The allograft gets integrated during the bone remodeling process. Therefore, it cannot be seen on the X-ray about 1 year after grafting.